about this. What's your understanding of what's going on first?
Well, the first thing is that the aim of the database, the sort of broad aim, is a good one, and that is to try and spot trends, drug side effects, failures, what works, what doesn't. That's a good aim. But the trouble is that it uses information which is the most sensitive information you could possibly have about a person. If you were my constituent and you came to see me, David, you'd have a confidentiality understanding between us. Your meeting with me is private.
Mm-hmm.
If you go to a lawyer, it's private. But most private of all is your meeting with your doctor and the information he or she keeps on you. And what it started out was the government was simply going to just appropriate the lot. It wasn't really going to ask anybody. There was a suggestion, I think Ruth mentioned it earlier, that they put a notice on a notice board. But how many of us actually go to a GP in a month? How many even read the notice board when you go to the GP? You're worrying about whatever is wrong with you.
Mm-hmm.
So it would have been done completely without people's approval, which in my view is utterly, utterly wrong. And so what happened was, October of last year, a number of us caused a fuss about this, and the government undertook to send a document out. But the document, frankly, looks like a pizza leaflet. A large number of people will bin it without looking at it. And in truth, this ought to be something you opt into. Not that you have to opt out from, but you actually opt into to say, yeah, sure, I'm fine, use my data. You'd easily get a significant proportion of the population. That's all you need. You don't need everybody for this sort of database, and that's what they should have done. They didn't do that. Now they're talking about allowing the database to be available to the police, to selling it onto companies and so on, all of which I think is inappropriate.
All right. What sort of companies, David?
Say again?
What sort of companies are we talking about here?
Well, probably pharmaceutical companies, but there's no limitation in the law. One of the problems, I thought actually Ruth was being a bit generous to the NHS earlier. One of the problems in the law is that a great deal of power rests with the National Health Service management themselves. They decide. Ruth was talking about approvals. Those approvals in future, let's say for giving information to the police, would not be your doctor saying, is this right or is this wrong to give it up? There's a lot of power for the doctor in that. It'll be some database manager making decisions over thousands of things. When it comes to selling the data, there's no limit on that. It could be anybody. It could be an insurance firm. Insurance firms could buy the data. Think what that might do to your insurance prospects. So this is completely insufficiently constrained. It should be much, much more limited than it really is.
So what's going to happen, David? Is it definitely going ahead, or are the government taking on board the concerns of people?
There's been some backpedaling. Already in terms of the leaflet, there's been some movement backwards. Then last week we had a controversy over a doctor who said, I'm not going to hand anything over. I'm going to opt all my patients out. And he was told he'd get fired, basically. He was threatened with being sacked, that it was in his contract. Again, disgraceful. These things should not be outlined in doctors' contracts. They should be outlined in the law. Anyway, they threatened to sack him. Now, and he was due to be met this Wednesday, day after tomorrow, now they're backing off of that. So I think there's a deal of rethinking going on. There's obviously a little bit of a battle going on within the health service itself over what's right and wrong here. And I think the BMA are beginning to change their mind. I think they're suddenly realising that they have a responsibility. And they're beginning to stand up and say, well, actually, this should be thought about again.
It's due to come in, start of March?
Yeah, March. I'm beginning to think it won't happen then because of the increasing controversy. Just apart from what I've already told you, there are other elements that are controversial. For example, if I opt out, and I'm going to opt out on principle, not because I care, everybody knows my data, but I want to make a point of principle on it. If you opt out, the data will still go forward. It'll just have your name, your date of birth, your postcode, and your gender taken out of it. But as I pointed out to a newspaper earlier last week, you're looking for me. Look for someone who's broken their nose 5 times. That will reduce 60 million down to, or 50 million down to about 100. Look at somebody who had a diphtheria jab a year or two at the age of a year or two, say 1950 or 50 to 51. That will pick me out. And you can do this, and it's been done in other countries. America's done. You can actually reverse. De-anonymize, as they call it. Mm-hmm. You can actually find people if you know 2 or 3 facts about them. Your medical record is like a fingerprint, and so it can be used. Now, I just think that we have to think very, very much harder about this. It's got huge benefits if it's used properly and it's done properly. But you don't need all 60 million. You could do it with 5 million, and you'd easily get 5 million volunteers. So it should be an opt-in, not an opt-out, and that's where the argument, I think, is beginning to go. But if people are concerned about this, they should write in. Write to their GP, write to their MP, write to the government, because it really, really is something where I think it sort of slipped through. People almost didn't notice it. And back in October, we saw the way it was being presented, and we said, no, this is not good enough.
Wow. So the information's, even if we opt out, the information's going to go anonymously then, as you're understanding.
Some of it will. Some of it will. That's right. I mean, so you haven't even got a proper opt out. Now, I suspect that will change between now and March, but at the moment, even the opt out's not as strong as it should be.
Is this a scandal?
I think it's more cock up than conspiracy. Let's put it that way. I think the people doing it are well-intentioned, but I think they have completely underestimated the importance of doctor-patient confidentiality. The man who created Dr. Foster, actually Kelsey is the driver of it, but his partner in creating Dr. Foster, the most important database on hospitals the country has said in terms, this should be an opt-in system, not an opt-out. People should be willing to do this ab initio. Now, I agree with that. It's not. It shouldn't be the government's choice. It shouldn't be my choice. It should be your choice. It should be the person whose information it is. Because although technically that information belongs to the Secretary of State in law, morally, I think your information is your property, and you should decide.
David, thank you very much for your time in explaining it this morning. Much appreciated. David Davis, MP for Halton Price and Howden. What do you think this morning?